Thank you for joining us for the fourth annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the key to accelerating innovation, a collaborative partnership event presented by the American Association of Kidney Patients and the George Washington University School of Medicine and Health Sciences. My name is Dr. Janice Lee. As a nephrologist, I am honored to serve on AAKP's Board of Directors and Executive Committee, alongside many kidney patients and care partners. I am currently a professor of medicine at Emory University in Atlanta, Georgia. I'm board certified in nephrology and hypertension. I also have the pleasure of serving as the clinical director of nephrology and of telenephrology and the chief medical director of Emory Dialysis, which serves over 750 patients. I'm proud to have been designated as a master clinician at Emory Healthcare and serve as the chief of staff at Emory University Midtown Hospital. More recently, it was an honor for me to be appointed to the nephrology board of the American Board of Internal Medicine. As a nephrologist, my research has focused in hypertension, chronic kidney disease, dialysis, and health disparities. It's been very exciting and rewarding for me to be a part of AAKP. It's actually been the most rewarding experience I've had throughout my medical career. I enjoy the patient advocacy, being involved in several initiatives to improve outcomes in kidney disease patients. AAKP is truly a patient centered organization. I've had the pleasure and opportunity to participate in several activities, such as being a senior advisor to policy, research, and clinical trial activities in conjunction with several federal agencies. I've been very involved in giving webinars and speaking on different issues that are relevant to kidney patients, um, mostly around home dialysis and increasing utilization, talking about the healthcare disparities that exist around home dialysis and transplant. Also focused on the COVID pandemic and very timely information for patients to help navigate during that very difficult time. I also spoke regarding how to use telemedicine so that patients could continue to be connected to their healthcare providers throughout the pandemic. And whether you are a healthcare professional or patient as an AAKP member, you can do the same. It is critical now that we as patient consumers raise our voices and create the demand for new diagnostics, devices, and biologics in our independent countries. Through AAKP Global, launched in 2019, AAKP is engaged internationally because we are committed to educating patients and leaders across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that a united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe care treatments. Globally, we are working with patients, medical professionals, researchers, and medical industry allies to cultivate a united consortium led by patients. AAKP believes this international consortium can advance innovation and change kidney care in countries where healthcare systems and/or infrastructure do not support patient consumer choice and/or access to care or treatments. For our panel session on a global drive for innovation in home dialysis, industry responds to growing demand for home therapies. It is indeed my honor to introduce a good friend and ally of AAKP's, Dr. Bruce Culleton, who's the Vice President and Chief Medical Officer of CVS Kidney Care. As a physician advocate for home therapies myself and medical director of our home dialysis unit at Emory Healthcare, this session topic is very near and dear to my heart. We're honored to have Dr. Culleton join us to share how CVS Kidney Care is supporting patient choices and access to home treatment. Dr. Culleton, I turn it over to you.
I'd like to start today by thanking the American Association of Kidney Patients and George Washington School of Medicine and Health Sciences for inviting me to speak. It's a pleasure to be here today. I'm starting today with a slide that should look familiar to many of you. For the rest of my presentation, I'll be focused on the United States and work we're doing in the US to improve access to kidney care, including home dialysis. But I really can't miss the opportunity to call out the many countries that are leaders in home dialysis. Halfway down this figure is the United States, with close to 15% of prevalent dialysis patients performing home dialysis. Many countries at the top of this figure treat more than 25% of all dialysis patients with either PD or home hemodialysis. There are many reasons for the variability shown on the slide, and where possible, we've been trying to incorporate into our programs what has worked well in many of these countries. Given the international audience, I'm going to briefly tell you who we are. Established in 2018, CVS Kidney Care offers a multifaceted approach to kidney health. We focus on early identification of kidney disease, care management, and expanding access to home dialysis in order to optimize care for patients with chronic kidney disease. Knowing that many of you are from outside the US, I want to tell you a little bit about CVS Health, the company where CVS Kidney sits. We have 300,000 or more dedicated colleagues in communities across the US. Our clinical team of physicians, pharmacists, and nurses provide care for almost 23 million medical members through convenient local health care, including Minute Clinic and Health Hub locations, and also through a variety of digital tools and virtual care offerings. More than 50,000 patients receive home-based and ambulatory care each month through Quorum, which has been delivering infusion and tube feeding therapy services for more than 35 years. We also have care management programs that deliver personalized products and services to millions of members, customers, and patients who are living with chronic conditions like cancer and diabetes and heart disease and kidney disease. So we're not just a corner drugstore. And now we're leveraging our care delivery assets and evolving our care model to support and augment the availability of high quality primary care. This will allow us to provide a more holistic approach to primary care and for many patients reduce the risk of cardiorenal disease and related complications. When we started kidney care, we saw there was a real opportunity to move care upstream and improve outcomes. Almost half of people with advanced kidney disease were not even aware of their kidney disease. And approximately 1/3 of people arrived at kidney failure having little prior management of their disease. And while a transplant is the gold standard of care, most people must undergo dialysis while they qualify and wait for transplant. This means in-center dialysis is the typical experience for more than 85% of patients on dialysis. During the height of the pandemic, we saw the exaggerated risk of COVID infection and heightened mortality in dialysis patients treated in dialysis facilities. In-center hemodialysis also means that every week, dialysis patients experience a 2-day gap between treatments. Adverse events like heart rhythm disturbances, heart failure, and stroke are correlated with this 2-day gap. In fact, patients with end-stage kidney disease spend an average of 11 days in the hospital per year. This results in high costs for patients and for payers. Providers, payers, and policymakers have seen these unmet needs for some time, but the last 3 years have been a fascinating time in the kidney space in the US. In 2019, CMS announced new payment models to encourage kidney transplantation and the use of home dialysis. In these models, nephrologists and their business partners are economically incented to deliver better care before end-stage kidney disease develops, reduce hospitalizations, and grow home-based end-stage kidney disease care, including transplant. Key provisions of the Cures Act also went into effect in 2021. This encouraged payers to enter into risk-based agreements with dialysis providers. In response to these policy changes, large dialysis providers have announced ambitious targets for home dialysis by 2025. We have also seen substantial investment by private equity and venture capital firms in new kidney care companies focused on changing the delivery of care to patients with kidney disease. On the right-hand portion of this slide, you also see our projections for the growth of home dialysis. We predict that the largest percent growth will come from home hemodialysis. This is partly related to high dropout rates in peritoneal dialysis and the desire for patients and providers to remain in the home. It's also related to medical cost savings, so important as value-based care grows, that can be recognized with more frequent or longer duration hemodialysis in the home. We also recognize that additional barriers to home growth must be addressed. Some dialysis providers are already struggling with nurse shortages, and this will likely worsen. Updating Medicare conditions for dialysis coverage is also urgently needed. This holds an opportunity to address the role of the nurse in the overall care of home dialysis patients. Policymakers and the private sector are also more aware and taking steps to alleviate disparities in kidney care, but true equity will not exist until we have scalable solutions for housing and food insecurity. Our approach to improving kidney health is based upon broad patient input, qualitative behavioral economic studies, and a view of what has worked well and maybe not so well outside the US. In order to bend the cost curve and improve the experience of patients and their family members, early detection and focused targeted education is paramount. We also believe in extending the care of primary care providers and kidney specialists to ensure gaps in care are addressed in between office visits. Let me take you through some examples of how we're doing this. We are centered on upstream and value-based care, new delivery models and dialysis technology, and digital solutions for all stakeholders. Underpinning everything that we do is health equity. This is a priority at CVS Health and within CVS Kidney Care, where we have a small but dedicated team focused on removing disparities in care. We work with payers to identify members with kidney disease, provide targeted outreach leveraging our advanced analytics, and educate patients on their care options. We are participating with nephrologist partners in the new CMS payment models and separate VBC models with physician partners. We have an existing partnership with Satellite Healthcare, a mid-sized dialysis provider known for their clinical quality. We are also building a hub and spoke home-based care model, and we continue our work to bring a new home hemodialysis device to market. Let me provide some additional detail on some of these products. I'd like to provide you just one example of how we use analytics within our business. A team of data scientists use proprietary public, and our clients' data to build sophisticated machine learning models specific to kidney disease management. We can accurately predict disease progression to dialysis of those who are within 3 years of needing kidney replacement therapy. We know when, how, and to what degree we should be trying to engage members in their kidney health. For instance, there is a point of acuity in which a member managing diabetes really needs to turn a hard focus on managing kidney disease. And thanks to our predictive models, we can predict with a great degree of accuracy how someone is progressing toward needing kidney replacement therapy. By way of illustration, if we look at these two members, they appear on the left to be very similar. Both 60 years of age, both female, both advanced chronic kidney disease. A typical program would treat them the same. We use our machine learning algorithms to actually tell that one of them is a very urgent case, probably less than 3 months from dialysis. And one, we have a little more time to prepare as she's closer to a year away from kidney replacement therapy. Just based on their temporal risk, our program will adapt to ensure that both are getting the right care at the right time for their situation. We also used advanced models and machine learning to predict hospitalization, optimal dialysis starts, and emergency room visits. Learning from hub and spoke delivery models outside the US and the clinical value that comes with having large home dialysis programs under the care of one team, we are testing models that allow us to bring care closer to patients, including just-in-time training in the home, virtual care team support, and access to services at our CVS locations, including our minute clinics and retail pharmacies. Although our study duration was impacted by the pandemic, we are now in the closing stages of our pivotal clinical study to support a 510(k) FDA submission for a new home hemodialysis device called HemoCare. This product supports our belief that home hemodialysis can be a mainstream dialysis therapy, especially in the setting of value-based care and the policy tailwind supporting home dialysis growth. In the design of HemoCare's products and services, we've also used human-centered design principles with goals to not just improve clinical outcomes, but also unburden patients and family members from end-stage kidney disease. We will be delighted to share more after market authorization. To conclude, home dialysis in the United States is growing, thanks to the organized voice of patient consumers, multi-channel advocacy efforts, and policy changes. To support and foster this growth, we are playing an expanded role in earlier identification of kidney disease, targeted and timely patient education, and the development of new dialysis technology and digital solutions. The full potential of all these efforts will only be realized through ongoing coordinated input and advocacy from patients, continued investment in kidney treatment technology and service delivery, and equitable access to care regardless of skin color, race, or beliefs. Thank you for your time today. It's a pleasure to be part of this exciting session.
Thank you, Dr. Culleton, for joining us and representing CVS Kidney Care.